Welcome back to Cheddar's Opening Bell. Well, we talk a lot about companies changing their models to help prevent people from getting COVID-19, but one company is sending its help to people who already have COVID-19. Veyo is helping COVID-positive patients reach life-saving medical appointments. And joining us now is the company's CEO and president, Josh Komenda. Josh, it's great to have you with us this morning. Explain how you're aiding in getting these patients to the care that they need.
Thanks so much for having me. I really appreciate it. Yeah, every day during normal circumstances, Veyo helps about 20,000 people get to and from doctor's appointments. So about 40,000 trips nationwide. And we really cover, a full gamut of treatments such as behavioral health therapy, getting folks to drug rehab therapy, life-saving dialysis treatment, et cetera. When the COVID-19 crisis hit extremely suddenly, we all of a sudden saw a massive flood of really unprecedented proportion of how to deal with this very rapidly spreading and dangerous infectious disease and how to protect the membership using our services. And NEMT is not normally designed to manage infectious disease. Our drivers are not paramedics. They're designed to work in a non-emergency context, helping people just go to routine doctor's appointments. And the vehicles aren't normally set up for it. So we did a kind of a rapid change to protocol where we realized we had to start identifying risks and do whatever we can to protect the membership, but also realize that people really depend on us for life-sustaining treatment, like dialysis. Most folks have to go 3 times a week, no ifs, ands, or buts. It doesn't matter if you're infected or you're a person under investigation. So we had to do whatever we could to see what we could do. The normal, yeah.
Now, how does someone book a ride to make sure that they get to the treatment that they need? And just to be clear, is it free or do people have to pay?
So the way Veyo works is we partner with health insurance plans. So we work with health insurance plans that offer a transportation benefit for those folks that need it. So members would call us directly, and if we identify that they need a ride, and then we also identify that they are a COVID-19 infected member or they're at high risk, that will put them into what we have designed is called our COVID-19 specialized fleet.
And so for people who have tested positive, you're able to determine that on their way to the appointment or before they get the car for the appointment?
No, we actually ask them to, if anyone's showing symptoms or has any risk factors, we first ask them to touch base with their healthcare provider by phone to get further instructions. They may have then, at some point had a test or had arranged transportation through an ambulance service or something to their healthcare appointment, gotten a positive test, and then subsequently they still need to go to their life-sustaining treatments. So once we've worked with their healthcare provider and or their health plan, and then we kind of move them into this designated fleet.
In terms of projecting the drivers as well, how are you ensuring that you have a proper fleet and that everyone is safe in the transmission of these patients?
So we worked very closely with our healthcare consultants and our legal partners and healthcare compliance folks to do with the best, come up with the best possible system. So we first of all screened drivers that have low risk factors. So folks with no pre-existing conditions or living with somebody living at home with somebody in pre-existing conditions. We've also provided them with extensive PPE, training on how to put that PPE on properly, how to take it off at the end of the day. Also just how to self-monitor for symptoms, all the do's and don'ts of what to touch and what not to touch, and how to carry themselves extremely carefully. We've also developed a fleet of specially modified vehicles, so that have sort of plexiglass and glass and plastic sealant inside the vehicle between the driver and the passenger compartment. So we've really done whatever we could to make it extremely safe for the driver, including a full hazmat and biohazard cleaning between every trip.
How is this making you think about your business long term? I mean, unfortunately, COVID could be around for years as in pandemic form, according to the World Health Organization. Has that made you go back to the drawing board and rethink how you operate?
Yeah, absolutely. I think it's extremely important for us, along with any company right now, to think about different scenarios and how things could bounce back in different ways. And how some of the changes to our healthcare system could potentially be permanent. I think we might be teaching ourselves that some telemedicine options are appropriate in some areas. And so we're trying to think about how we can use our logistics network to potentially support telemedicine transitions if that becomes a more prudent course of treatment in some areas.
All right, Josh, we got to leave it there. Thank you so much for joining us this morning. That's Josh Komenda. He's the CEO and president of Veyo. Well, coming up, one last check of the markets before we say goodbye.